Have you heard Medicare Advantage plans are bad? If so, don't go anywhere. In today's video, we're going to unbox the truth about Medicare Advantage plans. Hi, my name is Lindsay Engel. I'm the Medicare expert for Elite Insurance Partners and MedicareFAQ.com. You've probably seen a dozen different commercials for Medicare Advantage plans, especially around the annual enrollment period every October. They usually start with asking if you're happy with your Medicare benefits. Next, they'll tell you there's tons of additional benefits available to you, such as dental, vision, and hearing coverage. Some commercials will even throw a jab at paying a monthly premium for a Medicare supplement plan, followed with telling you that Medicare Advantage plans come with a $0 premium and could possibly give you back up to $140 or more in your Social Security check. When something sounds too good to be true, that's usually the case. Before we jump into the nitty-gritty about Medicare Advantage plans, I want to say that no, Medicare Advantage plans are not bad. It's good to have a few different options on supplemental Medicare coverage. The issue is these commercials can be extremely misleading and create a misconception. They convince you to jump ship and make a switch to your coverage before you actually thoroughly do your research. In this video, our goal is to make sure you understand how all these plans work so that you can make an educated decision on your healthcare coverage. Let's start with how these Medicare Advantage carriers can afford to offer you low or even $0 premium plans. The carriers pull you in by telling you that they have a plan that will cost you $0 in monthly premiums or just a few dollars. This is because when you enroll in a Medicare Advantage plan, the carrier will be paid by Medicare to take on your risk. That's the first way Medicare Advantage carriers make their money, because they get paid directly from Medicare when you enroll in their plan. When you enroll in a Medicare Advantage plan, also known as Part C, you're actually leaving original Medicare Parts A and B. You're choosing to go with a private carrier instead to manage your Medicare benefits. Another way Medicare Advantage carriers make their money is through cost sharing. Advantage plans are pay-as-you-go, meaning as you use the benefits, you'll pay out of pocket in the form of deductibles, copays, and coinsurance. Yes, the Medicare Advantage plan must cover the same services as the original Medicare. But here's the kicker. The carrier gets to choose how much of that service they will cover and how much you will pay out of pocket for that service. Many beneficiaries assume that if they enroll in a Medicare Advantage plan, they don't have to pay their monthly Part B premium. This is simply not true. Regardless if your Medicare Advantage premium is $30 or $0 a month, you still have to pay the additional premium for Part B. This is where the Giveback Benefit comes into play. You may have recently seen some commercials for this benefit. How this benefit works is that some carriers in some zip codes offer a Part B reduction. This means that they reduce the amount you pay in your Part B premium anywhere between just a few dollars to the full standard Part B amount, so that less is taken out of your Social Security check each month. Now, this is not a reimbursement. This is a reduction in your Part B premium. So how can these carriers afford to give you a reduction in your Part B premium? Don't forget, the carriers are being paid by Medicare every month to take on your risk. In addition, the less you pay in a monthly premium for your Part B and a Medicare Advantage plan, the more you're going to pay out of pocket as you use those benefits. So if you're paying a reduced amount for your Part B premium, your plan will have higher cost sharing. That's how the carrier recoups their money. Now that we've gone over how Medicare Advantage carriers make money, let's go over how the benefits work in comparison to original Medicare and a Medicare supplement plan. First, let's go over how provider networks work with the Medicare Advantage plan. Unlike original Medicare and Medicare supplement plans, Medicare Advantage plans come with doctor networks. These networks can be limited to a single county, a few counties, or even statewide. It's important to double check that all of your providers are within the plan's network before enrolling. It's also important to note that Medicare Advantage plans do not travel with you. So if you leave your plan's service area and go to a different state or even over to a different county, you'll have to pay the out-of-network cost for any medical services received. When you have original Medicare and a Medicare supplement plan, your coverage will travel with you across all 50 states. Next, we'll go over prior authorization. Before service is provided, your Medicare Advantage carrier may want to make sure that your service or treatment is considered medically necessary. In order to do this, the carrier may require you to get prior authorization before you receive any services or treatment. These requests can take a few weeks before they're approved. In addition, the request could be denied if the carrier doesn't think the service or treatment is medically necessary. To avoid any prior authorizations altogether, you can opt to stick with original Medicare and enroll in a Medicare supplement plan instead. Next, we'll go over maximum out-of-pocket limits. Medicare Advantage plans come with a maximum out-of-pocket limit. This limit is to protect you, the beneficiary, for paying a high dollar amount out of pocket for services received under Part A and Part B. The caveat is that the carriers can set this limit to be pretty high. It can be up to $7,500 or more. This can easily put a dent in your rainy day fund or retirement savings if you're on a fixed income. The other downfall is that these limits will reset annually on January 1st. So, if you're diagnosed with a serious illness or condition halfway through the year and end up getting close or reaching that maximum out-of-pocket limit in December, come January 1st, that limit will be reset. What this means is that if you're still receiving treatments, you'll have to reach that maximum out-of-pocket limit all over again. This could force you to pay it out of pocket twice within a 12-month period. If this is something that concerns you, then you should consider sticking with original Medicare and enrolling in a Medicare supplement plan instead. Last but not least, we'll go over annual changes. Medicare Advantage plans will change their premiums, coinsurance, copays, deductibles, and benefits each year. This means that year over year, your out-of-pocket cost and your benefits can change. You'll receive an annual notice of change letter in the mail each September. This letter will tell you what's changing with your plan that will become effective on January 1st. If you're unhappy with the changes that will take effect on January 1st, then you can take advantage of the annual election period that comes around every October. During this time, you can choose to leave your Medicare Advantage plan and switch to another one, or go back to original Medicare and enroll in a Medicare supplement. If you would like to avoid having annual changes and needing to review your plan and benefits year over year, then consider sticking with original Medicare and a Medigap plan. Medicare supplement plan benefits do not change annually. So, now that we've unboxed the truth about Medicare Advantage plans, are they bad? No, Medicare Advantage plans are not bad. It's better to have some supplemental Medicare coverage than none at all. As long as you understand how your Medicare Advantage benefits and out-of-pocket costs work, it could be a good option for you. Just make sure to do your research on all your supplemental Medicare options, including both Medicare Advantage or Medicare supplements, also known as Medigap, before you choose which one to enroll in. I hope you found this video helpful. If you did, don't forget to subscribe to our YouTube channel. Make sure notifications are turned on so that you're notified each time we upload a new video. We also have a great Medicare community on Facebook. We'll include a link in the description below so that you can join. Until next time, bye!